My presentation is titled Abortion, Suffering in Silence. In this presentation, I will show how the trauma caused by abortion can have PTSD, or post-traumatic stress disorder, indicators, and why it is so important to educate women on the potentially long-lasting emotional effects an abortion can have. My literature review was entitled The Physiological Implications of Abortion. In my review, I reported opposing views on this controversial debate. However, it is my opinion that abortion, which not only destroys the life of a child, can also have very harmful physical and psychological impacts to the mother as well. So, 4 symptoms of PTSD. In a 2016 publication entitled Counterpoint: Long-Lasting Distress After Abortion, Dr. Martha Shuping identifies several PTSD symptoms women experienced after abortion. Several studies back her conclusions and discuss the dangers associated with not giving women who have had an abortion the proper care and treatment needed. According to the Mayo Clinic, PTSD symptoms are generally grouped into 4 types: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. In an article published in Medical Science Monitor, a group of doctors performed a study finding that PTSD symptoms occurred after abortion, specifically that the women suffered from nightmares and trouble sleeping. One respondent described her dreaming about her dead baby and how it would take her hours to calm down and get back to sleep. Others admitted they did not want to go to sleep for fear of nightmares. Avoidance. A study done in Belarus described 2 women's experiences. One woman quit her job when a coworker became pregnant because she didn't think she could be around the woman as her belly grew. The memory was too painful for her. Another woman admitted to not going back for regular annual exams for 8 years because she didn't want to be reminded of the experience. She was only forced to go back when she had an infection that would not clear up. Changes in thoughts and moods. In the same Belarus study, researchers discovered that 80% of the women felt guilt and shame. This is an interesting fact because Belarus is a mostly atheist country, so faith-based remorse would not be a factor here. In addition, there are no protesters or public shaming outside of abortion clinics that would encourage feelings of shame or guilt. Changes in physical and emotional reactions. In the book Forbidden Grief: The Unspoken Pain of Abortion, Doctors David Reardon and Teresa Burke discuss the self-destructive behavior shown in some women after an abortion. Their book tells of a woman who, after the abortion, had 3 automobile accidents. She went on to say that my life became a series of calamities, accidents, and self-destructive benders. Also, a study conducted in Finland showed that women who had had an abortion were 2 to 4 times more likely to die from accidents. PTSD rates and abortion. An article published in BMC Women's Health in December 2013 conducted a study to see if there was an increase in PTSD after abortion. The study found that there were only a small number of women who developed PTSD within 6 months after the abortion, and of those that did, it was because of trauma unrelated to the abortion. So, the BMC article refuted. It is common knowledge that only a handful of those exposed to trauma are actually diagnosed with PTSD. For instance, a poll done by Hill and Ponton showed that even though 87% of veterans were exposed to a traumatic event, and many were exposed to multiple traumatic events during their career, only 12.9% were officially diagnosed with PTSD. The same can be said for women who have had abortions. Many will not be clinically diagnosed with any kind of mental disorder, but a high percentage will have emotional consequences from the procedure for potentially years to come. So, in conclusion, it is my argument that abortion can cause significant, lasting emotional and physical consequences to the women who choose to terminate their pregnancy. With over 60% of unintended pregnancies ending in abortion worldwide, there are millions of women being affected by this decision. More access to care needs to be available to these women, along with more admission from medical and psychological organizations that there are real and lasting effects to abortion.